temporal region and infratemporal fossa. Here are our objectives for the day. Let's begin by reviewing some osteology. So let's identify some of the relevant features of the skeleton of the temporal region. Then we're going to have a look at the muscles of mastication and give their functions. We will define the boundaries and contents of both the temporal and infratemporal fossa. We're going to list the branches of the trigeminal nerve and what they do. We're going to trace and identify all the major branches of the maxillary artery. We're going to describe what kind of clinical significance the middle meningeal artery has. Think of pathologies or accidents. Describe the pterygoid plexus and the venous pathways by which infection may spread to and from it. We're going to identify this nerve called the chorda tympani that actually comes from the facial nerve, but it's very important for taste. We're going to recall the course of the auriculotemporal nerve and its relationship to the middle meningeal artery, and we're going to then finally describe the structure and function of the temporomandibular joint. If we have a look at some of the osteological features first, you have the superior and inferior temporal lines. This region here is the temporal fossa, and here is the zygomatic arch. And the zygomatic arch is actually formed by the zygomatic process of the temporal bone and by the temporal process of the zygomatic bone, which would be right here, and that forms your zygomatic arch. Within the temporal fossa, you would find the temporalis muscle. Still with the skull handy with articulated mandible, you should be able to identify all of these following features. Here's your articular tubercle, mandibular fossa, the external acoustic meatus, the styloid process, the stylomastoid foramen for your facial nerve, and the mastoid process. If we have a look at the mandible, we can have a look at some of the features of the mandible on the next slide. The mandible from the lateral perspective here, so the external surface will be made up of a head, a neck, then you have the ramus, the angle is where it turns, the body, and then you have here the carnoid process, and this little dent here, this half-moon-shaped notch, is called the mandibular notch. And if you continue along here, there's a hole, which we already know because it's the mental foramen for the mental nerve, which is a branch of V3 from the trigeminal. And here these lines are actually attachment sites for the masseter muscle. If we have a look from the internal surface, on the internal surface there are a few prominent features that I have highlighted as bolded terms. Here's the lingula, which is a little protrusion right next to this little hole here, which is called the mandibular foramen, provides passage for a nerve called the inferior alveolar nerve. And then there's a groove, which is called the mylohyoid groove, which is a groove for the mylohyoid nerve and vessels. So if you were now to remove the mandible from the skull, you should be able to identify several structures. You should be able to identify the greater wing of the sphenoid bone, which is right here. That will contain the foramen ovale and the foramen spinosum. You should be able to identify the lateral plate of the pterygoid process. You should be able to identify the pterygomaxillary fissure, which is between the lateral plate of the pterygoid process and the maxilla. The inferior orbital fissure, which is between the greater wing of the sphenoid bone and the maxilla. The infratemporal surface of the maxilla. And the sphenopalatine foramen and the pterygopalatine fossa. Now we can start to have a look at our two fossae, which are in the temporal region. Again, the name kind of tells you where they're located. The temporal fossa is right here, and it's located above, so superior to the zygomatic arch, and it'll contain most of the temporalis muscle, and inferior to the zygomatic arch, and also deep to the ramus of the mandible, removed down here, you would actually find the infratemporal fossa, and that contains many structures. Among the structures within, let's go ahead and define the boundaries of the temporal fossa first. Superior and posterior would be the superior temporal line going along here, Anterior would be the frontal and zygomatic bones. Inferior would be the zygomatic arch superficially and the infratemporal crest of the sphenoid bone deeply. And deep to this, or the deep boundary, would be parts of the frontal, parietal, temporal, and sphenoid bones. And superficial, which we can't see here because this is only bones of the skull, would be the temporal fascia. If we now have a look at the boundaries of the infratemporal fossa, superiorly we would have the zygomatic arch superficially, remnants of it are visible here, and we would also have the infratemporal crest of the sphenoid bone deeply, right here. Anterior would be the alveolar border of the maxilla. Lateral would be the ramus of the mandible, which has been removed in this picture, and medial would be the lateral plate of the pterygoid process. The overview of the dissection is going to be as follows. We will study the masseter muscle first, and then we will detach the zygomatic arch and the masseter muscle, and we're going to reflect them together. Then we will study the temporalis muscle, and then we're going to detach the coronoid process of the mandible and the temporalis muscle together. Then we're going to remove the superior part of the ramus of the mandible, and we can trace some of the branches that come off of the maxillary artery. At the beginning of lab today, our dissections should look similar to this. As we've already dissected the face, you will have branches of your facial nerve, you will have a superficial temporal artery, and you will have additional parts of the facial muscles. Very important is going to be this one, because that's going to be one of our first targets for reflection. Next, stick to the instructions in the dissector, and first clean the lateral surface of the masseter muscle. Then you're going to cut the temporal fascia along the superior temporal line and use a scalpel to peel it inferiorly. And you're going to cut the temporal fascia also here along the zygomatic arch and remove it completely. And then you're going to use a probe as a guide and perform cuts 1 and cut 2, and then you should be able to reflect the masseter muscle. Next, you should remove the coronoid process and reflect the temporalis muscle together with the coronoid process attached. Then you should cut through the neck of the mandible, and then you should use bone cutters to carefully nibble away the superior surface of the mandible. So, stick to the instruction in the dissector. You will use a probe as a guide for cut number 1, for cut number 2. This is not a cut. Number 3 is not a cut. Do not cut this with a saw. Use bone cutters and carefully nibble away here until you've removed enough of the mandible so you can actually see some of the underlying or some of the blood vessels and some of the nerves that are deep to this. This is our structure and our region of the day, deep to here. Within the infratemporal fossa, you will identify the inferior alveolar nerve and its vessels. Right over here is the inferior alveolar artery and the inferior alveolar nerve. See, there's a little nerve coming off here, which is a nerve to the mylohyoid, goes to the mylohyoid and the anterior belly of the digastric. There's also the lingual nerve here, which is also a branch of V3. And there are many branches of the maxillary artery that we will all have to clean and carefully follow. Everything in this region is what we are looking for today. So we will very carefully have to clean this and make sure that we identify all these fine structures. I'm going to show that in a couple of slides again. So first we're going to have a look at the maxillary artery and some of its branches. We're not going to identify 15, but only the following 5. Please refer to the dissector for specifics. The middle meningeal artery is one of the most important ones. See, it travels superiorly and actually through a foramen called the foramen spinosum, and it then will travel, and the auriculotemporal nerve splits in two to let it pass through. And once it's passed through the foramen spinosum to enter the middle cranial fossa, it'll supply the dura mater. Next is deep temporal arteries. You have several. You have anterior and posterior. These will pass superiorly and laterally across the roof of the infratemporal fossa and then enter the deep surface of the temporalis muscle. Then you have the masseteric artery, which has actually been cut in a previous dissection step, but it courses laterally usually and passes through the mandibular notch to enter the deep surface of the masseter muscle. The inferior alveolar artery we've already dealt with. That will enter the mandibular foramen together with the inferior alveolar nerve. It is right here. And then you should have the buccal artery, which is right here, and the buccal artery will pass anteriorly to supply the cheek. Go ahead and already identify the lateral pterygoid muscle here. It has two heads, and this muscle is going to be important for us to help us clean and identify more of the branches. Here's another picture from my image atlas. This is Moses et al. At Atlas of Clinical Gross Anatomy. You can see a couple of structures that you should have already found. The masseter muscle actually should not be there anymore. You should have reflected that. But see, here's your external carotid artery bifurcating into its two terminal branches, the superficial temporal and the maxillary. Coming off the maxillary, here is your masseteric artery, which is also being cut in this dissection, and a deep temporal artery. Okay. In addition to that, here is your inferior alveolar artery, and traveling with it is the inferior alveolar nerve. In addition to that, you have here the lingual nerve, which is slightly anterior to it. And another branch from V3 is actually the buccal nerve, which is a sensory branch. The most important part of today's dissection lies all within the infratemporal fossa. We need to be able to identify all, and if not all, as many as possible, of the branches of the maxillary artery and all branches of V3. In addition to that, the chorda tympani, which joins the lingual nerve here. To do that, you're going to have to remove the lateral pterygoid muscle to see deeper into the infratemporal fossa. So, look at the dissector, page 214, step 15, and follow those instructions very carefully. Do not break any of the nerves or blood vessels. They are very vulnerable. So, once you've removed the lateral pterygoid, you should actually be able to see most of these structures. Especially, you have to go pretty far up close to the foramen ovale. This is where V3 exits, and definitely make sure that you can find your chorda tympani and see how it joins the lingual nerve. The last part of today's dissection is going to be the TMJ, temporomandibular joint. First, go ahead and identify the capsule of the TMJ, and then refer to the instructions on page 214 under temporomandibular joint in the dissector, because you are then going to actually cut open the synovial cavity here, and you will remove the superior part here, so the head of the mandible along with the articular disc. And you will have a chance to examine the isolated specimen, and you should see that the tendon of the lateral pterygoid muscle is attached to the neck of the mandible and the articular disc. And then you should cut the capsule open and have a look into the inferior synovial cavity and observe the shape and the variable thickness of that disc. Important for you to know is that there are two different types of movements that occur at the TMJ. In the superior synovial cavity, you'll have gliding movements that are between the disc and the articular tubercle, for instance for protrusion and retraction. In these paired images, you can actually see and appreciate the motion that occurs at the TMJ. Marked with M is the mandibular fossa, H and N are the head and neck of the mandible. So in the closed mouth image you can see everything is quite closely approximated here, but in the open mouth condition, if we have a look at a sagittal imaging picture here, you can actually see that the hinging movement has occurred, so the mouth is wide open, but also you've actually had a gliding movement that has occurred, so now the head and neck of the mandible are actually moved forward, actually moved anteriorly, because we're looking from sagittally here. For review purposes, I've listed a couple of items here. You should review the attachments and actions of your four muscles of mastication. You should make sure that you have studied an atlas illustration to know the origin of the mandibular division of the trigeminal nerve, which is V3, where it starts at the trigeminal ganglion and trace it to the foramen ovale. And from there on, you should be able to trace V3 through the foramen into the infratemporal fossa, and you should review the sensory and motor branches that come from there. Also, very important is that you have a very good dissection of the superficial temporal and maxillary artery, more so the terminal branches of the maxillary artery that you have hopefully identified in dissection. Many of these are bolded terms. And then lastly, the relationship of the middle meningeal artery to the auriculotemporal nerve. How I remember it is by saying the auriculotemporal nerve splits in two and lets the middle meningeal artery pass right through. And it passes right through there and then into the foramen spinosum, and from there into the cranial cavity. Here's a video URL from the University of Wisconsin.